Hi, I'm Jack Khouri. I'm a hematologist at the Cleveland Clinic in Cleveland, Ohio, and I'm here to talk to you about a phase 2 study that we participated in on a novel stem cell mobilizer called burixafor in combination with a drug called propranolol and G-CSF for mobilization of stem cells before stem cell transplant for multiple myeloma. So many of you know that stem cell transplant is still standard of care for multiple myeloma treatment. Currently, what we do before we go to stem cell transplant is we have to mobilize the stem cells. We have to get them out of the bone marrow into the bloodstream so that we can use a machine to collect them before the transplant itself. So the way we do that is with medications currently, injections. So we have G-CSF, which is a growth factor for stem cells. And we have a class of medications called CXCR4 inhibitors that we use in combination with G-CSF. We currently have 2 available medications from that class of medications. There's burixafor, which we've had for a long time, and we have a new medication called metixafortide. They both do the same thing. They just, allow the stem cells to leave the bone marrow and get into the bloodstream so that we can collect them with a machine. So far, the CXCR4 inhibitors that we have in the market, they're given the day before or the evening before we start collecting stem cells, which can be a little inconvenient for patients because they have to get an injection at like 4 or 5 p.m. and then go home and then start, collecting the morning after. So that can be a little inconvenient for the patients. The other thing is the current stem cell mobilizers, they cause some side effects like diarrhea and infusion-related reactions, mostly with the most recent CXCR4 inhibitor, which is metixafortide. So we're still looking into safer, and better tolerated alternatives, from that class of medications. The third thing is that most of the medications that we're using right now for stem cell mobilization were not studied in the era of frontline daratumumab therapy. Many of the patients with myeloma know that now we're doing frontline daratumumab for induction before transplant, and the drugs that we have available for stem cell mobilization were not studied, in this patient population. And we do have some studies suggesting that daratumumab may actually decrease the mobilization of the stem cells, so it may actually, reduce the stem cell yield before transplant. So we wanted to study a novel agent called burixafor that works similarly by blocking CXCR4 in the bone marrow in the era of frontline daratumumab. And the cool thing about this drug is that the mobilization of the stem cells happens as soon as the first hour after we give the patients the drug. So it's given intravenously on the same day of collection of the cells. So it's not done the day before, like we're doing with the current medications. It's given IV, 1 dose, and then 45 minutes later, we start collecting. So patients don't have to get it the night before. It just happens on the same day. So the time burden is better with this medication, and the kinetics of the stem cell mobilization are faster. So we combined this drug in this study with a pill called propranolol, which is a beta blocker. I'm sure a lot of patients are familiar with this class of medications that we give for heart, cardiac conditions. And we obviously use G-CSF, which is a cornerstone of stem cell mobilization. So we enrolled 19 patients on this study, and we found that close to 90% of the patients collected enough stem cells, meaning 2 million or more, to proceed to transplant, which is great, in 2 sessions of collection. And then, more than 85% of the patients that received daratumumab in the frontline setting were able to also collect enough stem cells, so more than 2 million, and proceed to transplant, which is really great. So the majority of the patients were able to collect, and they did not need to go through another mobilization and collection phase to be able to collect enough stem cells to proceed. The other cool thing is that the drug was really well tolerated. We did not see, major infusion-related reactions. We did see just 1 infusion-related reaction in 1 patient, but it wasn't really a common occurrence. 1 patient only had diarrhea, which is something that we see with the other CXCR4 inhibitors. But the majority of the side effects were really low grade and were not really deemed related to the study drug. So this combination is really novel. It's a pill with an injection and an IV. More than 90% of the patients achieved the needed amount of stem cells to proceed with transplant. The safety profile was great, and the drug is given on the same day of collection of the cells. It was not given the night before, so it's less trips for the patients and it's more convenient.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.